Motion by Simon.
Is he good? No.
Steve, if you have a minute or two after Tiffany, I wanted to talk to you about some vaccine paperwork. Okay.
Yeah, it's right next to me, actually.
Madam Chair, you want to start with?
There it is. Okay, good. Welcome, everyone. Let's start with this introductory piece. Chapter 107 of the Acts of 2022, known as an act relative to extending certain state of emergency accommodations, was passed by the General Court and signed into law by Acting Governor Karen Polito on July 16, 2022. That legislative action revised Section 20 of Chapter 20 of the Acts of 2021, and in so doing provided modifications to Massachusetts open meeting law, which allow for flexibility to hold remote-only and hybrid meetings while preserving public access and, where appropriate, public participation. Currently, that additional flexibility will expire on March 31, 2025, unless additional legislative action occurs. As part of today's meeting, hybrid meeting, all votes will occur via roll call. All right, so let's start with approval of the September minutes. Any edits?
Yeah.
Second?
Second.
Okay, all in favor to approve the minutes? Rob?
Aye.
Kathleen?
Yes.
Steven?
Yes.
Rachel? Yes. Okay, Tim, over to you for future meeting dates.
Sure, just following up on what was included in the email. November 10th, which is the second Friday, which would typically be the Board of Health meeting, is the observance for the Veterans Day holiday. So I don't know if the board wants to move up or back 1 week with the Fridays, or if it would prefer to just choose another date where folks are available. Kristen listed out the other Fridays that we have, and I don't think we have any other conflicts with holidays, at least in this fiscal year.
If it's worth anything, I'm not available on the 3rd. I am available on the 17th.
And I'm the exact opposite.
You're the
Of course.
exact opposite. And if Rob says one thing, Ed would say the exact opposite. Yeah. So are we better off maybe doing a doodle poll then to try to?
I can do the 17th. Rob, can you do
If
17th?
everyone else can do 17th, I would say just keep it simple, and I'll unfortunately have to miss.
Cross our fingers for Ed.
For Ed, if Ed can't, then we'll have to miss.
So, yeah, I can do the 17th.
I'll
That
confirm
can be
with
a
Ed.
backup.
Okay.
Yeah.
So if
Wanna
Ed
do a
isn't
doodle.
available on the 17th, I will send a doodle to folks, but we'll plan tentatively for the 17th then.
Okay.
Great. That was easy. We're flying through the agenda.
It's all up to Steve.
Madam Chair, the next item
Yes.
is a brief update about the FY25 budget and fall town meeting. There will be there may be many issues on the town meeting warrant of which the board has interest, but the two primary ones relate to non-operating budget sources of funding. Children's Hospital is building, as I think the board knows, a large outpatient center in the Needham business area right next to TripAdvisor. As part of the host community agreement, in lieu of personal property taxes, which is taxes on equipment, and given that it's a hospital, there probably would be fairly expensive machines that would be taxed. So in lieu of taxes on that, Children's Hospital signed an agreement with the select board committing to pay roughly $200,000 a year. Once when this building permit was issued, once at 50% completion, and then annually after occupancy every year. So basically 200,000 every year. So far, the town has 400,000 in its hands. The plan from Health and Human Services was developed with input from myself and Tiffany, but it's the idea of Sarah Shine, our Director of Youth and Family Services, to have 2 mental health clinicians added to her team. Sarah and her team are responding to significant increase in youth mental health challenges. They devote a significant portion, the supermajority of their time, to working with or in the schools. So these 2 clinicians would be targeted for slightly different roles. One would be sort of targeted as a community clinician that would work closely with the Park and Rec department and the library, including potentially having a social worker available at the library, stationed on site at the library for a number of hours a week. The town is searching for a library director, so we will have to obviously work and confirm that whenever she or he is hired, but it was something that the previous library director was supportive of. I think the library trustees were very interested in. So one of the articles is to appropriate money for that purpose. The second clinician would be focused on community training. We're making a big push on youth mental health first aid. The town is trying to, through the schools, basically train 10th graders, the entire 10th grade in youth mental health first aid. And youth mental health first aid is essentially a peer model, and Karen is one of the trainers that we have, Sarah's another, and some of Sarah's staff, where you as a youth would look for signs of mental health distress in peers and have training in sort of how to respond and recognize that. So the 2 focuses are sort of a community social worker with Park and Rec and the library, and basically a social worker who does mental health training. I think it's a good plan. The finance committee had a lot of questions, although most were related to sort of the timing of deposits and the financing mechanism rather than the content. But they voted to support it unanimously, which was positive. So that will be on town meeting warrant, and I'm hoping that that is a fairly easy approval. It's always a little bit easier when it's not operating budget money, but sort of free money that's coming into the town. The second item is for the opioid settlement funds. We've talked to the board about this. The town has received thus far, or last fiscal year, the town received 217,000. This year, I believe it's received about 60 so far, but anticipates receiving about 140 over the course of this fiscal year. This is money that the state has set up as part of a legal settlement with pharmaceutical manufacturers, distributors, and pharmacies related to the impact of the opioid epidemic. The plan from the town, and this will be led by Tiffany with help from the substance use prevention team, is to ask for 140,000, so about 2/3 of the money that was reserved last fiscal year, with a focus on a small initiative for sandboxes to place basically Narcan reversal kits that we've talked to the Board of Health with AEDs. And I think we would anticipate doing that in town buildings, and then if there's funding, and we would find funding, potentially talking to Housing Authority about co-locating it there. A recovery coach, a peer recovery coach in the community, someone who has responded to and recovered from substance use challenges themselves, who works as a peer-to-peer coach with people who are currently in recovery or want to get into recovery. The majority of the funding, about 85 or 90,000 of the 145, would be for 3 things. A comprehensive public engagement process with key informed interviews, stakeholder discussions, and community forums to reflect the community's preferences and input on what it would like to see the settlement fund used for within the framework the state set, with sort of 7 broad category areas that included access to treatment, recovery services, substance use prevention, mental health promotion. There were 7, and I don't remember them all off the top of my head, but what the community prefers within that context. We will make a special effort to reach out to subpopulations that are disproportionately impacted by the opioid epidemic. So that could include persons in recovery, family of currently substance addicted or formerly substance addicted persons, people who have been incarcerated as a result of substance misuse. So we would try especially to get sort of input from those groups that maybe are less commonly found in sort of typical focus groups. That would produce an end report. We would hire a consultant to do a strategic plan. We would hire that consultant sort of at the beginning, so they would hear all of these discussions, see all of these key informed interviews, the focus groups, that sort of thing, and they would see the final report, and then they would come up with a 5-year strategic plan. We're gonna get opioid funds over 15 years, and as I think I've said before, we don't want to be too Maoish, but it seems like 3 5-year plans would be a good kind of way to measure our progress. The second part of that consultant's charge would be to develop an evaluation framework. So we want to track progress. We want to try to measure the efficacy of the work we are doing. So they would, based on the strategic plan and the feedback from the community, come up with an evaluation framework where we could track the effectiveness of our work over that 5-year period. The idea would then be to do that again for years 6 or 10 and do that again for years 11 through 15. Both of those topics, how to sort of spend the children's hospital money and how to spend the community opioid settlement money, will be on the town meeting agenda. I should say, Finance Committee did approve the community opioid settlement plan that was presented by Health and Human Services by Tiffany. Not unanimously, there were, I think it was 7-2, yeah. But in general, we're mostly supportive.
What were the objections?
One was the sandboxes. The other one, we don't know.
Yeah,
They
one person
never
didn't say,
spoke
ask
about
any
anything,
questions, but one person did talk fairly extensively about their concerns that
Narcan.
locating Narcan could harm people or could give the wrong impression or could seem like the town is permissive towards substance misuse.
They weren't necessarily finance concerns, they were more, yeah.
Yeah, we've got a lot of community education to do, obviously.
I think that was very, good way to look at it.
Yeah,
Did try to talk about, that Narcan doesn't have counterindications, that if someone is sleeping and you think they are overdosed and you administer Narcan, they might be upset that you interrupted their nap, but they're not going to have an adverse health outcome. But I think there were still concerns, so certainly a lot of community education. But we were really happy that Finance Committee voted to support those. We're hopeful that town meeting will support them. As I think the board knows, we had gone to Finance Committee last year with a tentative plan that looked very much like this plan. They wanted more public engagement, and so we withdrew it, and there were questions at last spring's town meeting about why the town wasn't going to spend the money yet. So we came up with a plan that involves more public engagement, which is never a bad thing. We've actually done the procurements related to this, and we have contracts in hand that would start in November if town meeting approves it. If town meeting doesn't, then we'll have to cancel those contracts, but we're ready to hit the ground running. So we're excited about that. The FY25 budget is something that we're working on right now. In general, we are looking to make permanent ARPA positions in all of the HHS divisions. So that includes key staff members in public health, a key staff member in youth and family services, and a key part-time staff member in human services. It's a big ask. That's basically 3.5 FTEs that we're asking to put into the town budget permanently. They've been funded by ARPA funds for a while, and they will continue to be funded by ARPA funds through December 31st, 2024. Yes. So we put in a future form last year that said, hey, just as a heads up, we're going to be putting in, we're putting this in, but we're not asking for money this year. Now we're going to put in a form that says, hey, we're asking for money, but we only need half a year's salary for people. But please be aware, next year, we're going to have full year's salary for people. We've talked extensively with the town manager's office. We are, cautiously optimistic that that will be supported. I do think, we would love the board of health support with the select board and the finance committee about the importance of those positions for senior mental health, for youth mental health, for our public health staff in terms of our data analysis capacity and our nursing support. So we're excited about those, but that's something we're working on right now. The budgets are due the 27th. We're shooting to submit early. We're also going to be submitting a capital, multiple capital requests for aging services. Aging services finished their space study. It was presented to Council on Aging Board last May or June. We divided it up into a series of small projects that could be done separately or could be combined with some potential cost savings. The projects ranged in cost from 16,000 to about 900,000. There were 7 in total. The library was a little bit behind, but they revised their space study to basically give the same type of end result as ours. They had originally come up with sort of results that were like, we need $15 million, and they divided it up into smaller, here are 3 projects. Working with the deputy town manager for operations, we are submitting basically alternating years. Capital plan is 5 years out. Normally, we put things in the 5th year. And then over the course of the next 5 years, they move up to year 4, year 3, year 2, and then they're up for funding. We are requesting that the town consider them outside that order, and we're putting in a request for design and feasibility for library in 25, construction for library in 26, design for aging in 26, construction for aging in 26. I sort of leapfrog or going back and forth. That's what's going to be put in. That's not necessarily what's going to be funded. And the town does have a number of other capital commitments, including work on the schools that are certainly going to take up quite a lot of funding. And the permanent home for DPW. Don't ever go in 470. It's not fit for human habitation. So I think it will be a challenge to get all those funded on the timeframe we want. The top priority for the Director of Aging Services, for myself and for the Council on Aging Board, is actually transforming the kitchen to be a commercial kitchen. Very closely, almost tied with the fitness room, expanding the fitness room so there can be more senior fitness options. I think the benefit for traveling meals would be substantial in terms of having a professional production level kitchen. There would also be certainly some flexibility and benefits in doing research. So Tanya and I talked to a number of communities, and they're able to be very creative with some of their funding, some of their community events. So we love the idea of trying to have a sort of full production kitchen that produces sort of healthy, fresh meals on site rather than having frozen meals reheated. So those are sort of the operating budget and the capital budget submissions that are going to go in. Capital budget's due on Monday, the 16th. Operating budget's due on Friday, the 27th. We're also going to put in a couple other non-ARPA requests for some additional staff time. Those are pretty modest in nature. Some environmental health inspection staff time, some administrative time in aging. I don't know if those will be funded or not. And honestly, our ARPA positions are the top priority.
And what is the date of the town meeting where these?
So it is October 30th, Monday.
And you hoping that a board member can attend?
Yep. So Ed is, I think, still a town meeting member.
Yep.
Tejal is chair. You are an ex officio member or de facto member, whatever the term is. But you're a voting member of town meeting. I do think that it's always helpful to have a board member there to speak. And I think it's, always a little bit dangerous to try to predict what town meeting is going to be focused on and what it's not. I think we have good plans to address community priorities, and we're using, for lack of a better word, free money. So I hope they won't be particularly controversial.
Yeah. Okay. And then on the capital projects, is there any sort of, like, what's that process look like, where you have to kind of defend those, I'm assuming at some point?
So I think that's with the select board and the finance committee that we have to push select board and town manager first to, advocate and push for funding. A lot of it's sort of gonna depend. By its nature, the way we did the aging study was designed to be if you have spare money. So it's not a $15 million, it's this building is a decade old. If you can find $500,000 or, you know, by $300,000, we can have a much expanded fitness room with more, you know, athletic programs for seniors. If you have $900,000, we can have a brand new kitchen that can produce traveling meals and senior meals and community dinners. You know, so it's really going to depend on the Board of Health, the Council on Aging Board, and others conveying to the Select Board and the Town Manager that that's a priority. And then what money the town can sort of find under the couch cushions. You know, if you're trying to afford a school and need $100 million, you're not going to find that out under the couch cushions. You might find 200,000 or 300,000 or maybe even $1 million under the couch cushions, you know, in terms of free cash that's turned back, overlay surplus, other things. So it's partially a making the elected officials understand that this is a priority for multiple other elected boards, and then crossing our fingers and hoping that there will be some found money the year that we're up, basically.
Any other comments or questions? Okay. All right, let's, thank you for those updates. Let's move on to the public hearing for Board of Health Article 7 body art.
So, Madam Chair, if I could, I think this is not particularly controversial, the changes, but we did advertise it and the publicly posted agenda as 9:30.
Oh.
So just in case someone else is interested, either online or in person, we should probably wait to sort of open the hearing until 9:30.
Okay.
I don't know if you're okay, maybe we could jump to the Select Board Code of Conduct.
Yep.
So we put together the agenda fact sheet and we included the context, including the sort of cover letter and then the policy. The Select Board developed a code of conduct for themselves and their members with town staff, town council, other parties. The Select Board is putting it out there if other boards are interested in adopting it or taking part of it and making it their own, and whether that would be a good policy. A lot of it, I think, is, you know, fairly non-controversial, you know, making sure members commit to, you know, policies about not sexually harassing people and not harassing or discriminating against people, that sort of thing. Some of it is more, I don't know, good practices, I guess, for lack of a better word. I've never actually had an issue with this, but, you know, they say all members should read the materials in advance. You know, it clarifies what the board already currently does, which is members notify the chair and myself if they need to, are unable to attend or need to attend remotely. The chair can approve that. You know, some of it I don't think is something we have trouble with, but like members shouldn't be tweeting during their meeting. The Board of Health doesn't really have executive sessions. The Select Board does, often related to the terms of collective bargaining or real estate purchases or legal settlements. The Board of Health, there are very few cases where the Board of Health can legally go into executive session. This Board of Health has not in at least a decade, maybe ever. Steve might.
Yeah, more like 2. Okay.
You know, and there's good reason. A lot of the board's discussions are about policy, and policy discussions should be free and transparent and accessible. So I wanted to put it out there for the board and just give the board a chance to discuss whether they're interested in it. Some of it, you know, we would try to change slightly, like use of town council. You know, basically, if the Board of Health needs town council, you would let me know and we would contact. Kathleen has done that specifically in the context of the biosafety committee, and someone who had consulted for her firm submitted testimony on behalf of one of the developers who was looking to build a lab. She recused herself from not only voting, but also the discussion on the advice of council, town council. So a lot of these things are codifying practices, I think, that the board already observes. But there might be value in, you know, having them down in writing. Certainly for new board members, if they're elected, it's helpful to say, here's a document you can read that contains all of these things, as opposed to just generally when things come up, oh yeah, you should talk to town council if you think you might have a conflict of interest.
Yeah, I mean, I think it's good to have something like this, especially as you said, for new members coming in, but just to make sure that we have clear policy on some of these things. Stephen, I remember last time you mentioned something that around like speaking outside of the board or something that you were concerned about. I can't remember what it was.
Yeah, because we brought this up last month.
Yeah, and I mean, I think if you can tweak it for things that just aren't relevant,
Yeah.
or, you know, because we're not the select board.
Yeah.
I think it was something that if we're speaking outside about, you know, advocating for vaccines or something, there's anything that limits us from doing that here, but I don't see that in this
I
language.
think the one thing that maybe we would codify is just, you know, when a board member is speaking publicly, they can say, you know, I'm offering my opinion as a professional and I am a member of the Board of Health, rather than this is the Board of Health's opinion, and just being clear, like the Board of Health took a vote and I'm carrying that message publicly versus this is my opinion personally.
Or as a professional, or,
Yeah.
yeah, I think that would be good.
But I mean, often, I think if we're talking about public meeting context, I'm thinking back, Steve, to some of the underground utility issues and the 5G issues when there were public hearings. People specifically asked, we want a member of the Board of Health to attend, we want a member of health to speak at these, because I remember a very crowded meeting at the senior center, maybe on a town hall too, where they were basically wanted a public comment from the board, a board member.
So is, I'll agree that seems like a good thing to move forward with.
So if that's something the board wants, what I would do is I would turn around a red line version of this for the board to consider next month and discuss, and then maybe the board would, depending on what changes you want, we would consider it in
Back
December.
and forth a little bit, but sure.
Yeah, I like it as like guidelines, and it has links to all the regulations that are important. It's like all in one place, which I think is good, particularly for newer and for refreshers for some of us. So it's great. Thank you.
Yeah, I agree. I think it's something that we should have. And as Tim said, I think we do a lot of this anyway, but it is good to have it written down and we have a framework to refer to.
I think the board also knows we're trying to formalize a little bit some of the things maybe we did partially. Kristen was previously with the town manager's office. They had a particular way that they would send public comments that are received to the board. And we're sort of picking up that practice, which is not that we will send everything immediately separately. Sometimes we will wait and batch things and like, here's the 3 things that came in this week. Or if it's sort of important enough or loud enough, for lack of a better word, we will send it just directly that piece of correspondence rather than wait till the end of the week. So we're already trying to do some things that are maybe formalizing some of our previous practices or updating our practices.
Great. Okay, so we'll see this next time around.
Yes.
And we are at 9:29, so we can chat for 30 seconds. Phone turns to 9:30.
Nobody is online, okay. Pretty interesting. I do think that we have an opportunity to more fully assess some of our articles, including potentially body art, in terms of the content, the policy. Tara will talk more about it, but this is largely sort of technical corrections, which is why we were comfortable bringing it to the board with very little previous discussion. One of the things that we're trying to do in new regulations is, especially when there's a reference to fees or charges, say the rate is whatever the Board of Health posted fees and charges are, and the board votes annually to set those, rather than have something codified into a regulation that says it's $25 when that may have been the rate 5 or 6 years ago.
Definitely. All right, we're at 9:30.
You want to formally open the hearing, Madam Chair?
Yes, so we are opening a public hearing for the Board of Health Article 7 on our body art policy.
Okay, so as you know, we were looking at updating that fee line that Tim was just talking about, and also adding that we will have the practitioners have a Corey Sori conducted as well. So those are the two items we discussed last meeting. So we went ahead and added those sections in and updated our definitions, as you see, added the Corey definition, the Sori definition, added that section under the practitioner requirements to have that Corey Sori conducted, and also updated that fee line in that section for the establishment. So if you're okay with those edits, then we can go ahead and move forward.
Seems to be back
Fine to
anyone?
me.
Yeah.
Good to me for our
Agree.
previous discussion, yeah.
Okay. Okay. Great. So we'll make those edits for you.
And no one is on for public comment? Okay. Do we need a vote to approve? Yeah.
Yep.
Okay.
Okay.
Motion to approve?
So moved.
Okay, second,
All in favor, Rob,
Aye.
Kathleen,
yes.
Stephen,
Yes.
Pedro, yes.
Thank you.
This public hearing ever.
All right, so let's move on to the public health strategic plan.
All right. Okay, so we got the two different documents in there in the packet. The first one is just the explanation of what we've done so far. And then the second one is kind of how we came to, or the process of dying down to our one-year deliverables. And obviously this is a 5-year plan, so this is just the first year deliverable. We'll continue to work through the rest of them as we go on. But we've been working with BME and Copper Strategies to really kind of work on the strategic plans. We have to have it, one for accreditation, but for two, it's good practice because we haven't officially done one yet. So it's good for us to have guidelines and a roadmap for what we should work on based off of community health needs. Since we've never done a full community health assessment through our department, we utilize BID Needham's community health assessment a lot, and then use the senior assessment, thank you. She's done a lot of that. Yes, Needham Parent Survey, Metro West Health, Adolescent Health, so we kind of put all that together. When I say we, really Julie has almost completely done the whole community health assessment. So that will come later because it's almost finalized, to be finalized next week. But that is where the areas of goals come from what we hammer down to the needs within Needham. On the table over here, that is, takes us down to our one-year deliverables. Yeah, I guess any questions or any thoughts on the process or anything specific? They are gonna start key informant stakeholder interviews, and you likely got an email from Tim already. So they'll be reaching out to you if they haven't already to do that via me and Copper.
I saw two things. there.
Sure.
Under guiding principles, page 2, we approach our work with commitment to advancing racial and health equity. Left out ethnicity.
Okay.
And those two usually go hand in hand. Alternatively, just leave it as equity, so you know, inclusive of everything.
Yeah, I was thinking maybe I would just say health equity, because, you know, there's other factors like age or weight or, you know, gender, or other things that are critical. So I don't know that you have to call that out for racial, because there's just so many factors that, you know, you could pull in as you think about really getting to health equity.
So you think health equity is more of an overarching term that would
The whole
encompass
thing,
all of
Yes.
it? Okay.
On the other, and you may have answered this, just in saying that these are one-year deliverables, but looking at, board priority number 5, supporting strategic use of remediation funds, and area, you know, goal areas are mental health and substance use, and it just looks like that everything is substance use and there's nothing on mental health.
Yeah, we did talk about that at our last strategic meeting, and we need to include more mental health in this process. So that is because this is still draft form, so that is one of the things we have with this, especially adding in more mental health into that. So yeah, thank you for that.
I had a question as well. So as you think about this document, is it meant to be kind of focusing on, as you say, key priorities, or really encompassing all the activity that's done? So I was thinking about, the environmental health work that's done, food safety, some of these core public health types of things, but that I don't necessarily see in these strategic priorities. And so curious how you're.
Yeah, so the strategic priorities aren't necessarily what we do day to day. The strategic priorities are what we felt needed to come based off of the community health assessment and what we can do as a broader aspect to those things. So we kind of had to work a little backwards when we started this, because we started the strategic plan after we did the community health assessment. So we came up with the needs from the community health assessment and then worked backwards for the overall strategies based off of the information from our mission and vision to tie it all together. So yeah, these don't include our day-to-day activity type things. These are our strategic planning so that we can then reassess and in 5 years say, did we hit these to decrease these core measures within Needham? But our basic duties that we continue to do will just be regular goals and activities that we'll reassess, but not based off our strategic plan per se, unless it's a priority from the strategic plan.
And, I think it's good to have here's overall our goals across everything that we do. And then these are these core, things on top, but to make sure they sort of align or tie
Merge.
together.
Yeah, we definitely could do a document, or, we still don't necessarily have Board of Health goals either specific for this year. So in that process, we can create goals, but I think while we're trying to tie it all into accreditation, it really has to focus on our community health assessment. So that's where that kind of come from, but we can write a different goals document for sure.
Well, and one of the
Annually.
reasons, one of the reasons I say that is I know with strategic planning, one of the key things is, you want everyone in this department to see how they tie to your strategy, right? And they're like, well, geez, I spend my whole day doing this and I don't even see it.
Yeah, so there's owners on the side, but again, we still have work to do. Like Stephen noticed, there's no major mental health things in this. So defining specifically who and what and how is still in the process, but that is the goal. And it's part of the mission too. So we revamped, the new mission is in there, and that encompasses hopefully everybody, including our new regional team that we will be working with. So hopefully we tie it all in together.
Any comments?
I was gonna ask about the amount of data wrangling you have to do to put all these different surveys together to get, do we feel like we need our own community?
Oh, yeah.
Okay, so that's the next
100%,
step. Okay,
yeah.
because I know what
Yeah.
that's like, but,
Yeah.
and are you getting even the same question? Obviously
Yeah,
not.
so
So,
again, Julie's left her job for the last few months doing this, but she's done a great job of pulling it together, but we definitely are noticing gaps.
Okay.
And as we've always said, the gap between, 21-year-olds to 65, we have hardly any data on that process. Unless they're a parent and take a parent survey or something like that, but that's specific to substance use. So yeah, we're missing a lot of data that we know and hope to put into our budget in the next few years, money for, so we can provide our own community health
and again, it
assessment.
seems like all these communities will be doing this too. It
Yeah.
seems like a regional, can we sort of put resources together rather than reinvent the wheel 300 and however many
Yeah.
times in the state, how many towns there are. Anyway, it's just.
Yeah, there's different models, like as a matter of fact, and I'm gonna butcher it, Worcester's,
Okay.
but they do it regionally with multiple different
Oh,
groups. So
okay.
theirs is different towns and different cities that they do together to show within that. So yeah, that's definitely something we can
Great.
aim for as well.
I do think we're not including it, we're intentionally not including it in this year's budget request, but if we are successful in applying for and receiving public health accreditation, which we will hopefully know by next September, we would have to start putting into the budget in fairly short order requests for maintenance, which would include an annual fee and potentially some additional staffing to try to maintain the work we've done. I think as part of that, we would like to build up a little bit of funding so that we could administer more sort of reports on the community health, basically. I I'm proud of the work that was done on the senior survey twice. I'm very proud of the work that was done in the housing authority health assessment. But those are sort of piecemeal, and having a comprehensive community health assessment would be quite valuable, because we really do have that missing middle that Tiffany referenced.
Yeah, and correct me if I'm wrong, but Julie was also able to find multiple different data sets from other sources, from like DPH and stuff like that, that aren't specific to Needham, but to the region, to kind of try to fill some of that gap, but we definitely Needham specific
And
missing
around census, what happens with those data? I never see that.
from the town,
Yeah.
town census.
Does that ever get public? We fill it out every year.
Yeah.
Where do they go?
Goes to Teddy.
Yeah,
I gotta figure out what she does with it, so we can.
yeah, but I mean, it
answer.
seems like a really, I mean, when we were trying to
know,
figure out
every year.
vaccination rates, was like, we have the town census, can we use that denominator? It seems more accurate than DPH's random, anyway, that's not to raise the issue, but.
I do think if it's not in a report that's posted online, it's hard for us to go to the Public Health Accrediting Board and say, here's this number, if we can't trace it back. So yeah, if the town doesn't post its census
Right.
results,
Right,
I don't think they do.
Yeah. okay, sorry,
We can ask why they
Good
don't.
question.
yeah, sore spot, sorry. I like data, it's good to know more than less.
And leveraging it as opposed to reinventing it.
Right, yes, exactly.
All right, any other comments on strategic planning? And so, sorry, I have a comment, or question, the timeline for completion of,
The end of December is the timeline for completion, so we're kind of right in the middle of the whole thing.
okay. Let's move on to individual serving alcohol bottles.
Okay, perfect. Okay, so this, if you saw the letter from Kate to Tim, is considering the restriction of individual serving alcohol bottles. So in reading this and talking with our substance prevention team and which ways we go about this, there's two different ways we look at how this can be done. This can be done as miniature alcohol bottles that way, like restricting, or if you want to, or not allowing those to be utilized or served in Needham, or they can go the plastic route of not allowing the plastic bottles of that size to be served in Needham. And we've seen both in different communities. So like Chelsea has gone the alcohol route. We're no longer allowing nips to be served or sold in the town or the city. But other towns have gone the plastic bottle route. They make two very different and distinct ways of doing it. So that's why we kind of would like your input, because the 0.3 here, the small bottles are linked to underage drinking. We don't really have a lot of data on that. We have data that they drink, but we don't know if it's nips. We don't know where it's from. We don't know what kind of bottles they're drinking from.
Yeah, my suggestion there, reading that, was that part of our response back to the select board is we think that there are other more proven methods of reducing underage drinking. And I think we have a few suggestions for them that they have yet to follow.
Yes, although they
Yeah.
did take some of them when they revised their alcohol regulations, which is progress.
Progress, but if they're really interested in that part of this, please follow the suggestions we've already provided, which are proven, as opposed to something we really have very little data on.
Yeah, sure, although I guess my thought would be, could we do and? Here's our feedback on this issue,
Mhm.
and as a reminder, X and Y
Mhm.
would be really helpful. Although, some of it is things that are within our control. So Chief Schiller has been a real supporter of compliance checks for both alcohol and for tobacco. And having those occur more frequently, I think our ultimate goal is to have them be quarterly with our tobacco compliance checks rather than just semi-annually. So some of the things are also within sort of our span of control. We can work with Chief Schiller to try to make that happen. We can make our staff available. We can ask him to make, a couple extra officers available so they can do it quarterly instead of semi-annually. But I think we wanted to understand if the board is interested in the staff doing more work on this issue, engaging with the select board about, should these be banned from a substance use prevention perspective? Should they be banned from a environmental perspective, or should they be neither?
Well, what data do we have that, I mean, people are saying it's causing litter and it's additional workload because they have to move them when they're trying to mow. I mean, this is the first time I'm ever hearing of any of this.
Yeah, so
Do we have data on this at all?
numbered data, we have to look for it, I think, a little harder if we wanted to try to find something. And one thought was talk to the police and see if when they go on calls, if this is an issue or if they track that at all. The other one would be through the photo voice that we've done in the past. A lot of those pictures are of NIPS. So those, but not anything hard and fast specifically related to substance use.
The point being is, somebody has a bellyache and they make a complaint that, nominally could fall under our jurisdiction from an environmental health standpoint or from, substance use standpoint. But this board has always operated on data. Just because somebody has a complaint doesn't mean that all of a sudden, we say, yes, we should have a regulation. Like, so,
Yeah,
because somebody else will come up with something else and then, well, why aren't we acting on it?
sure. So I guess the question is, do you want us to look into it and do a presentation next month on what we find, which may be nominal or maybe more? And then we can talk about this a little bit more onto whether or not we want to pursue.
I mean, I would be curious for the people who are maintaining parks and other things, if they're seeing a lot of this around. Is it contributing to, a lot of work for them, but also, is it around playgrounds? Is it around,
Yeah.
where
is
are
it?
they seeing it, if they are seeing it? So any kind of data, qualitative or quantitative, and then, that third bullet, it sounds like there isn't really good data saying these small bottles are linked to underage drinking, but I don't know how much you've dug into that, but I'd like to at least know if there's any data about that.
Yeah,
seems
or
like-
or DUI, I mean.
Yeah,
you know,
any of
that-
that.
Yeah.
that we
I just
should
don't
have
know
from the
what-
police department.
Yeah.
Problematic
issue.
consumption. I mean, you do read, you read any of these memoirs, it's like,
Yeah.
it's a common, people hide them in their pockets and things. And if you've done lots of river cleanups, Waltham, different places, you're picking up a lot of those, but
Yeah.
I don't know about Needham, as I haven't seen that.
I've seen them in
here.
parks. I mean, I've
Yeah.
seen them in Charles River Reservation or other places, but the high school too, like is the high school seeing these in the high school memorial field, after football games. There was a notice that went out to high school students saying no drinking please at football games. So clearly there has been, which is a big shock, right?
Yeah.
But I'd be curious what they're seeing. So I mean, if we can get any data that helps us decide if it's worth pursuing, I think that would be good.
Yeah, we can
And
work
some
on
of
that.
these are very marketed to kid, like if you see at the checkout at some of these places, it is not just a small whiskey that somebody needed for a recipe, it's cotton candy, it's almost like
Yeah.
the vapes, some of these products, right? You guys see them. So it's maybe not just the nature of that, it's who they're marketing to.
Yeah.
But do we know why?
Do all of our liquor stores sell the small bottles? Or is it only some? Do we know that?
Yeah. I would assume they all do, but we don't know for sure.
That would be an important piece we have to get.
Yeah.
Yeah.
Okay, so more to come.
Yeah, we'll put a more formal presentation together with what we can find.
The other thing is, I mean, I think the select board is the one that actually has the authority on this, right? They have taken alcohol away.
So I think it depends on which way we go. If you go the
Mhm.
plastic route, I think the Board of Health has the ability. I think if we go the alcohol route, it's the select board.
Yes, although
My point
I
being, the select board in and of themselves could just say, something, we're gonna ban the sale of
Yeah.
nips in
Yes.
town.
Yeah.
They can do that. They don't need the cover from the Board of Health to do that, which is what they're looking for. And I'm not inclined to give them that necessarily.
cover and legwork.
Yeah, yeah.
We're looking for someone to do the research.
Right.
So. But it's appropriate for us to gather more information and present it to the board and, yes, but that is, we are reading that memo correctly.
Awesome, thank you.
Okay, let's move into staff updates.
And Madam Chair, if I could, I think Karen, you were hoping to, maybe if you could start,
Yes, thank you, Tim. Sure. I appreciate
then
that.
we
I
could do
have
regular order.
one of our prevention team members on a Zoom call. I wanted to introduce her.
She's not on, Karen?
And she's not, she said that she was.
Unless she's under your name.
She said, you don't see her.
Is she under your name?
Probably.
Oh, there's me. Okay, maybe.
Sorry, I'm listed as Karen.
It's okay. I'd like to introduce Vanessa Ronsky. She joined our department in early June. And Vanessa is part of our STOP grant administration, so she's funded by the grant. And I thought I would just let her introduce herself.
Hi, everyone. I'm happy to be here. Thank you for having me. So as Karen mentioned, my name is Vanessa Vronsky. I joined in June. I have my master's I started as public health and then I transitioned to healthcare admin. Now I'm public health again. But I worked previously with C4 Innovations. They're a great organization based in Needham. They used to be based in Needham, now they've moved. But they did a lot of recovery work, prevention, in terms of homelessness, substance use, alcohol use. So I'm very familiar with the field that I'm currently working in right now. But as Karen mentioned, I work a lot on SPAN and also the STOP grant that does the compliance checks, the tips trainings and all that good stuff around alcohol use, prevention for youth around Needham. So thank you for having me.
Thanks, Vanessa. So in terms of updates for the substance use prevention team, most notable last month, we worked with the Needham Police to where they conducted an alcohol compliance check. And good news is that of the businesses checked, there are 29 active licenses right now, and 26 of those businesses were checked. 3 were not open. We had 1 sales to minor violation of an off-premise business, and the way that really happened was the underage operative presented their ID. It was looked at and misread. It was not scanned, and they sold to that underage person. So that's good news, because our previous checks, as you've seen, have been much higher in terms of sales to minor violations. That was one of our primary activities last month. And from SPAN, we've been busy in the community, tabling at different events. We've been working on the strategic plan with the help of a consultant from Bright Solutions. And we are getting ready for some of our reporting requirements for the STOP Act grant this fall as well. So happy to answer any questions you might have.
Next time we do compliance checks, we need to make sure that residents in homeless suites, they've not been tested in the past year.
Yes.
Keeping, not open.
Right. I agree. I think there's a real concern there that they're holding a license, but when we send our operative in, the front desk just announced that their bar is not open. So we really need to maybe ask the police to help us find out a little bit more, or maybe the town manager's office to investigate that a little bit more. The other entity that is hard for us to access is the Village Club. It's the third one that wasn't open. So the 2 hotels and the Village Club.
Karen, just clarification on the establishment that failed because of a misread. Unless I'm mistaken, I thought the driver's license was set up so that it was the different shape if they were underage. So is that a misread, or is that really an education issue?
I think it could be a combination of both. The operative had the vertically made, the vertical license that is a straight out indicator of being under 21. There are 2 dates on most of these licenses for their age, and I think that this person perhaps looked at the wrong one. We've seen that happen occasionally in other instances as well. So I think it's taking the time and being careful to look closely at the dates as well as just even the physical design should be an indicator as well. But they also didn't use the scan, and you might be familiar that the newly updated alcohol regulations are requiring every business to use a scanner. And I can just mention that for all the business, many of the businesses that passed their compliance check, they did it with a visual inspection of the license, and many did not use their scanner even though they have it. So I think that's a training issue perhaps at many of the businesses to ensure that the scanners are used.
I wonder if we should add that as in, pass with scanner versus without, because I think, that's supposed to be used, right? So
Right.
we need to give that kind of feedback, and the select board needs to give that kind of feedback. I'm assuming they're meeting with fit-ins, but I think, they should at least
Be aware,
communicate to
right.
organizations that passed, but,
Right.
are at risk because they're not using scanner. So it'd be good to track that.
How did the final reg end up? I thought it was like only if they look below a certain age or something, they're required to scan, or they should scan or something.
In fact, they've changed that. They,
Oh, did
in the
they?
regulations now is if anyone appears under the age of 40. It was 30,
Mhm. So, okay,
so.
basically almost everybody.
Right.
Okay.
Just one other little quick note, we reinstituted sending letters to the businesses that passed their alcohol compliance check. A note of congratulations just from our chief of police to acknowledge that. That was something that had been developed when our SAPSI grant was in operation, our regional SAPSI grant quite a few years ago. We brought that back to test that out with the chiefs, obviously collaboration.
We're gonna send it out to the ones who use the scanner. Because, in the future, we really, I understand that the end result here is what we want. We don't want them selling underage. But frankly, if they're not following the reg, they're not following the reg.
And the likelihood of really reliably doing this is based on these gas scanners. So
Yeah.
I think, there should be some communication like you passed, but
Right.
you didn't use a scanner and, it puts you at risk.
And maybe next time, we're gonna include the scanner as part of the task. If we fail, we can use the scanner.
And that's part of it. Right.
I don't know how to tease that out, because again, the end result's the important thing. They're not selling underage. That's what we would heard.
But especially given our sample size is so
Small,
small,
right.
likelihood of failures is
it's
much greater.
higher, if they're not using the scanner.
I think we need to distinguish that
Right.
and give them feedback.
Bring that back to the police too and. Thank you.
All right, so back to the start.
Yeah.
Ginny, nursing.
So we started our flu clinics. On our September 16th flu clinic alone, we immunized 124 community members. Our youngest member was 10 months old. I was excited about that. And our oldest was 96 years old. And up until September 28th, we immunized a total of 201 community members of flu. And right now, we were only able to access COVID Pfizer vaccines through the state, through the Bridge Access Program, so it only covers 18 and under or underinsured or uninsured. Right now, which is why we need you afterwards, just so we can order private COVID vaccines and see how much we can order based on how much it is. But we aren't offering it right now to anybody else. It's a terrible feeling to tell people we can't give it to them and they can't find it anywhere in the pharmacy either. Like, I guess they're scheduling appointments and getting canceled, and then they get bumped back to us, and then have to say, we don't have it for you.
Sorry, was you just talking about COVID?
Yeah.
So we are able to purchase it through McKesson, but since it costs us $22,000 for 200 doses, it's a procurement thing as well. So we're working through that process, but I do think we can get it next month or next week, which is why we need a signature. So, but hopefully we'll get it in and then at least start to do some of those. We do have a few doses to use from the state for under 19, and then the bridge access program for underinsured and no insurance. But even that got cut by like 2/3 of what we actually ordered.
Yeah.
Because it's just a rollout. It's not
60
going well.
doses for 11 and under, and then 300 for 12 and over.
Do you know if the kind of residential living places, I mean, they usually do their own flu vaccine stuff. Do they have COVID vaccine? Or
So the state is requiring them to provide it to their residents. But I do hear the same thing, that they're having a hard time, because it's the purchase aspect that is, and it's so expensive,
Mhm.
that it's just making it a little difficult, so.
Okay. Next up, Michael, emergency management.
Good morning. Towards the end of August, MEMA determined from the initial damage assessments of the affected towns from the August 8th flooding event that no county met the public assistance threshold, which is a hard and fast threshold. For individual assistance for FEMA, it's more on a subjective gradient, but MEMA determined that it was highly unlikely that any community, any county would meet that threshold. So at that point, the state transitioned to small business administration loans. The small business administration came out September 7th to the town. On September 6th, they did their damage assessment, a preliminary damage assessment of Middlesex County. At that point, Middlesex County did not qualify for small business administration, which would have enabled Norfolk County to be a contiguous county. So they came in on the 7th. 16 properties were identified as having major damage, but 25 properties in each county are required. So at that point, that was sort of the end of the road for receiving federal assistance from that flooding event. The way both FEMA and the Small Business Administration, and really all the federal government works at the county level. So even though there were, affected properties in Newton and Natick and stuff, that, this was a regionally, if you didn't look at county borders, we almost certainly would have hit that threshold. But unfortunately, the way the county borders work, we were unable to reach that threshold for federal assistance. From the town side, we produced an after action report, and we're continuing to work on that, really focusing on, producing public messaging in advance of severe weather events. So it was a bit of a scramble to get public messaging out there. Typically with, severe weather, you have some forecasts, and with this incident, we had none. But as we saw in Leominster last month as well, that these sort of no notice severe weather events are becoming increasingly common. So we're working through the process now to sort of front load that public messaging on the town website, pre-identify public alerts, stuff like that.
Yeah, notice what would have changed.
We would have, if we had noticed, we could have sent out alerts, we could have upstaffed, particularly for dispatch. So typically when we have
Would we have prevented flooding?
no, no.
Right, so I think one of the questions is, do we have adequate drainage in those areas, and can we do anything about that as a town? That might not be just us, it's obviously DPW, but I mean, that's what's happened in New York, right? They can handle 1.5 inches of rain per hour. That's it, that's what the storm system can handle. I don't know what the storm system can handle in that area for our town, but if it can't handle adequate rainfall and we're anticipating more, that's how we prevent the flooding. Yes, it's great that we can get notices out, but if we can't stop the damage anyway, what's the point?
I know the DPW is working on assessing their water system as well, and going forward with that, but I don't have the technical expertise to speak on that.
But I do think communication is really important, and having people be aware, because they might also go driving in an area that is flooded and not even realize.
Yeah, and they can move stuff out, I mean,
Exactly.
yeah.
So it's multifactorial things that need to happen here. I do think the drainage issue is a huge issue, knowing some people in my neighborhood that really got flooded. But But and would that be text alerts or what sorts of alerts would?
Yeah, so our alert system that we have, our Rave Alert, it can go to text, email, and landline. About a little over 13% of the town is opted into the text alert. So our intention is to do a, Saturday noon call to all the landlines in town to validate how many landlines are actually still in use, number one, and number two, to encourage people to opt in to that system as well for text.
Yeah, it sounds like it needs to get really promoted, and this is a good time since people know things have been happening, that maybe they can be convinced. Plus, some of those landlines may actually be cell phones. Yeah, I would say if we're only at 13%.
And then there was one event where they did do that afterwards, where there was an upcoming rainstorm, but, again, it was sort of the same prediction as that August storm, but didn't turn into the nightmare that did, but they did do a message out. I got one, I think.
Yeah,
right?
yes,
So
we sent that out
prepare for that.
the next week.
So
And
I think that's good.
yeah, and one of the things with that is our current procedure is that whenever those alerts are sent out, they have to be approved by the town manager, the police chief, the fire chief. So one of the things that happened with sort of the delay with that storm was we had our EOC meeting first, then crafted the message and then got approval and then sent it out sort of towards the tail end of that event. So that's why we're working to pre-script the messages now so that they're already pre-approved and just say, send that message now.
Right, yeah, that's good. Anything else?
No, that was the big one for the last one.
Okay. Emergency preparedness.
Yes. Hello, everyone. Over the past month, we have achieved several milestones, all of which support our commitment to emergency preparedness and community well-being. And here is a brief update on recent key activities. One, our junior MRC program plan has been successfully completed, and the draft has been sent for review. This plan is vital to our new program and will guide us in the future. Two, we have coordinated and supported the nurse unit with many duties related to vaccination clinics. Three, we have successfully drafted the after-action report for the recent active threat drill involving public health and park and rec staff. The report has been submitted to our management, and we are going to use it for the accreditation project. Fourth, we have been actively engaged in providing feedback and answers to the contractor for the second draft of town emergency shelter plan. Ensuring town shelter plan is comprehensive and effective is a priority. In closing, we would like to express our sincere gratitude for Needham MRC volunteers, dedication and hard work. So this is from our end. If you have any questions, please let us know. Thank you.
Thank you. Any questions? Okay, great, thanks. All right, accreditation.
There's actually not much to report this month. We submitted the readiness assessment to the Public Health Accreditation Board. We expect to hear within a couple of weeks, and took a little bit of a breather, but I'm pleased to say that everybody is still working pretty hard on producing the documents that we will need. What we'll hear from Public Health Accreditation Board is whether or not they think we should go forward with applying for accreditation. We will have the option to go forward with application even if they think we're not ready. So we'll have a decision to make once we hear from them. Any questions from anyone? Okay, thanks.
Thanks, Lynn. Okay, traveling meals.
Okay, no, nothing new really to report. Pretty straightforward. Nothing urgent that happened, so we're still keeping the program going, so. Unless you have any other questions or,
Distributing COVID test kits, you can get those now from the US Postal Service.
yeah, we had some in our office that we were trying to distribute, so.
Right, but if people are asking for them, we should
Can have
direct them
that.
there right now, so they can get 4 kits for free.
Our kits expire November 19th, so we should them out to before they expired for the last time, so.
All right, epidemiology.
I included, just sort of a few, COVID metrics, based on conversations that we had, what feels like forever ago at this point, probably beginning, the spring maybe. But the state, has actually just started publishing a bunch of new dashboards. So they have a respiratory illness dashboard and a immunizations for respiratory diseases dashboard. So that's definitely going to change. They've made these changes very suddenly. And so those dashboards, I think, are probably going to change the way I can present this data. So we'll see what this will look like in the coming months. I'm hoping it will be better, if anything. But they did replace, the dashboards are replacing basically this report that gives me this vaccination data on the top and some of the information on hospitalizations, but it should be able to give more information on hospitalizations and immunizations for COVID, flu, and RSV, which is really great. The respiratory illnesses dashboard will go over, it'll show percent of ED visits due to, acute respiratory illness, hospital admissions due to acute respiratory illness. I think they'll give a breakdown by COVID, flu, and RSV. Current trends, past trends, it's really exciting. The immunization dashboard is not available yet, but I look forward to exploring that and sort of seeing what I can show you in the coming months. As Tiffany kind of had mentioned earlier, I've been working a lot on the community health assessment still, but we hope to have that finished really soon to be able to show that to you. And then the community health assessment priority areas are being included in the community health improvement plan and the strategic plan, and it's all linked together, which is great. What else? And the biosafety committee will be meeting on October 24th for the first time, which is really exciting. We had a company that already exists in town submit their new application under this permit, so we'll see how that goes. But I'm excited for it. It should be good.
Good. All right. Questions? Okay. Substance use prevention. Is Carol?
Yeah.
Carolyn, maybe you're here.
Yeah, I can start with some updates. Carol and I are pretty optimistic moving forward with submitting a strategic plan in the coming weeks to BSAS, the Bureau of Substance Addiction Services, and then we'll be able to begin implementing those strategies if they are approved in the fall and early winter. We may have shared before, but we're excited that Walpole and Westwood will be participating in the full Metro West Adolescent Health Survey that Denham and Needham participate in. We met with the new Westwood Superintendent, Tim Pavovar, and that process of taking surveys will happen next month in Walpole and Westwood. We also had our first in-person meeting with BSAS since COVID in Waltham with the leadership team and other grantees, and I was able to meet a lot of people there that I haven't had the chance to meet in person. We also have been supported by Tim and Tiffany in hiring a youth engagement intern who will conduct a photo voice project with our 4 towns that have Needham, Walpole, and Westwood. We've used photo voice in the past by the department and the Mass Call 3 grant and SAPC grant. It's a program where people use photos to share a story about a social justice issue. Our goal is to have youth present the final gallery in the late winter and early spring with the goal of enhancing policies and regulations related to access and availability of alcohol and cannabis. And we have conducted interviews and we're in the usage of contact and references, so hopefully we'll have an intern for you all to meet soon.
Thank you, Anita. Right, anything else? Questions for Lydia? All right, so next up is environmental health.
Okay. So Sai is on vacation this week, in Thailand. I'm really jealous of that. So I'll be covering. So our highlights for this month, basically, we had a couple updates on staff. I think we had told you that we were close to hiring part-time environmental inspector. We did hire Pamela Ross Kung, 10 hours a week. She's been hitting the ground running, trying to get some of her equipment up to speed, but I think she's a great fit. She's trained us before in Standard 9. She worked with Diana Acosta, so we're really honored that she's picked Needham to kind of work with us, and now she can kind of help us spring forward with maintaining our FDA food program standards that we've been adopting. So we're really excited to have her join our team. We've also, I just wanted to give an update on the conferences. So I was able to get into, take the annual Yankee conference that took place in Northampton. And so he did that as part with our funding that we got from our NEHA FDA grants. We also were able to continue the promotion of our food safety excellence program. We started our training forums. We've done 2 so far, had pretty good turnouts. I think the first training we had about 50 establishment staff members present. And then this past week, we had one as well. We had about 30 that came through. So we're, again, still promoting this out. We have our last 2 trainings next week. So we have a couple evening trainings. So hopefully we've been trying to do some in the morning, in the afternoon, in the evening to hit all the time frames. Needham Cable also taped this week's training, so we're gonna be able to post that link as well. So if we don't get full, participation with all the establishments, we're gonna be reaching out to those establishments saying, watch this training, we'll email that link out. We wanna get these survey evaluations back from them as well and get that feedback so we can use that for future trainings. So that's where we're at. Again, we're doing a Spanish virtual training as well. That's one of our trainings to be held next week. So we're also getting that bilingual information out there to everyone. We've had a couple inquiries from our first 2 trainings where they want the policy translated in Portuguese. So Tim was able to work with us in getting that policy translated. So we're doing that as we get the requests in. So we've already got a bunch translated in different languages, but we're able to take more as we get the requests. So that's great. And so the other item, Nutritionally Needham is now happening, as you know, throughout the month of October. We were able to get all the menus out to all the establishments that are participated. We want to reach out to them mid-month-ish, so probably next week, just to kind of see how it's going. I did talk to a few participants this past week for part of our trainings that we're doing the Nutritionally Needham. They said so far so good. They're getting the menus and they're putting the inserts, the Nutritionally Needham menu approved items into their regular menus as an insert, and then that's how they're kind of distributing to the public. So far, we'll be able to drop off more menus as they need them as well throughout the month. I haven't gotten any inquiries as far as needing more so far, but we gave them 50 to 100 menus to start, to see how that would go. But so that we're happy about that. Let's see. So I think for the most part, our main goal would be just to kind of promote this next training, make sure everyone gets on board with taking that for next week. And we'll go from there. So unless you have any other questions or.
You said that you're gonna launch your pilot program on November 1st.
Right.
And is that like you said a random number of 30?
Yes, so we were able to kind of pinpoint 30 to 40, we have like 10 extra, 40 randomized establishments that we took from our database so that we could kind of have that request for them. And we reached out to them ahead of time to say, you've been picked to give us feedback on our food safety excellence program that we piloted starting November 1st. So we will be making sure that they will be actively getting feedback from them as this program gets rolled out. We're working with Relevant, our Food Code Pro software system, as far as getting the grades set up the end of October, as well as the fees set up, so they're already automatically be tallied, which is great. We can do that with our system. So we're working with Diane from Relevant the end of October to have that initiated. It's November 1st. So that will enable, you know, these grades to be shown and the fees to be shown on their inspection reports that we conduct. The inspectors, we've also been having meetings about this, that we'll be able to basically actively train at that point, because the grades will be there, the fees will be there. I'm sure we're gonna get questions from the establishments on, what does this mean? Does this count? And we can go through that at that point. So that will allow us for 6 months to kind of educate, again, you know, you can do better on this grade if you do X, Y, and Z. These are the priority violations, these are the priority foundation violations that we're docking you for, that if we can be more proactive in the future routine inspection, then we wouldn't have to dock you for those points. So that will be, I bet we haven't got many questions during the forum training so far, and I bet when we start rolling this out and they see that it's been, you know, piloted now, it's started, we'll probably get a lot more questions at that point, so.
And can you remind me, I should remember, but once they get a grade, is this gonna be posted publicly, or how does?
Not yet. So again, we'll be having this all internal for that whole 6-month process. And then we're looking to potentially publicize it starting the summer of 2020, you know, next summer. So basically, and then we have to get the website set up where we could post like the checklist of the inspection. That's what we're thinking of having that be publicly, you know, shared. And we've let everyone know about this, that this will be happening. So, but yeah, that will be potentially next summer. We'll have this out there, so. Yeah, so hopefully that be a good rollout and we'll be able to gain the feedback. We'd be happy to present you with feedback as we get it. You know, we could do that on a monthly basis or however. But yeah, so.
So we talk grades, but I thought we were saying like it's an X, it's sort of like up or down.
Yeah,
not
so-
like A, B, C, D. We're not.
Right, it's basically
Okay,
a
just
90
making
or
sure.
above would be a certificate that we would
Okay.
be putting in their
Okay.
window.
Mhm, okay.
When this becomes official next summer.
Mhm.
Yeah, so it's not technically a grade, but
Right.
we're using a 0 to 100 grade, you know,
Right.
number system, I
Yeah.
guess you could say.
Yeah. It's like a TripAdvisor thing and not
Yeah.
like you stick in the window,
Yeah,
right?
put it in, yeah.
Yes, right, okay.
Correct.
It's that ABC thing that can really hurt restaurant, you know. like
Right.
If you're meeting the standard, you're meeting the standard. Okay.
Yeah, so that's the goal.
All right.
Is this, no, I just didn't know if we're gonna spend any time talking about 1688 Central.
Sure.
That's an environmental issue, so I thought this might be great.
Yeah, so the board has seen one or more, I think,
Two, yes.
emails related to 1688 from residents. I did talk to town council, I just want to make sure I catch his words correctly. My talking points my response was gonna be based on the board's discussion last month. In particular, basically the fact that the board heard the issues and we still haven't seen confirmed evidence that there's environmental contamination, and that absent that evidence, the board's powers to essentially interject in private property are limited. If the board wants to intervene to protect public health, it can. It just has to have a solid basis if it doesn't expect to get overturned easily in court. And a solid basis would be a DEP report, a report from the fire department. They had to go on site for a fire and they saw drums of chemicals leaking or something. It's not sort of anecdotal reports from neighbors 3 or 4 decades after the fact. And it's unfortunate, but I think that's kind of the reality. If this was public land, if the town was trying to do something like this in a park, that's a little bit different, but this is private property.
We said we were gonna send a letter to Mass DEP. Have we done that?
Yeah, we have a draft ready. We can
So we
send it,
haven't sent it yet, though.
not yet.
Because I thought we should get that out, and, you know, if DEP has jurisdiction, we should be directing members of the public to contact Mass DEP directly.
And I have talked to DPH and DEP, and they start very concerned based on reports from residents. When we go through the situation, they sort of go, oh, well, that's really sticky if we don't have evidence. So I think that's the challenge is And I've sort of said to them, this has been going through the process at the local level. It's been a multi-year process. It has been involved in court. But we will send the DEP letter today. And we'll include the fact that we sent a DEP letter in my response to the residents. who said concerns.
That'd be good.
Okay, I might tell them that, if they have, they should also be petitioning, aside from sending stuff to us, and they'd also want to petition asking.
Yeah. That makes sense. I think it's unfortunate. I think I believe the residents, the concerned sort of neighbors have formed a group and they are challenging the ZBA permit. Given that the legal finding in the case was essentially that the town erred in imposing extra conditions on this, I don't think that's likely to be changed, but the concerned neighbors are also sort of pursuing another option by challenging the ZBA permit.
All right, shared services.
Sam, do you want to come to the table, Sam?
Oh, I think carry two.
Yeah, but you can both.
Yeah.
Sorry, the sound isn't quite clear. Is it Sam or is it me? Sorry.
I think
You can speak first.
Okay. Hi, good morning. Sorry for the confusion, folks. This past month, we've been working on trying to get going on hiring. We are looking to set a couple of, set some interviews up in the next week or two for a regional health agent position, for a regional trainer as part of our training hub, and then for a regional nurse. And I'm thankful to the staff we have in Needham helping us review resumes and being part of the interview committees. I don't want to jinx us, but I think we finally have a meeting date set for our first shared services meeting. I have told people and students for years, scheduling is often the hardest part. And this has proved true this time too. So we should be meeting for the first time this fiscal year on October 19th. Sherborne, that'll be hosted at the Sherborne Library, thanks to the town manager there. We also have been working on our campaign of getting out and meeting people. We had a good meeting with the Board of Health from Medfield. Was very interesting. Had an opportunity to talk with their inspector there. It's a consultant named Bridget Sweet, who has worked in the industry for a long time and is very interested in being helpful with us as she can. That Board of Health was interested in knowing kind of how they can use the resources. And we'll continue conversations, and we'll be doing the same with the other communities. And then I think it happened this month, but I'm very excited about it. The performance standards, the Office of Local and Regional Health released performance standards for local public health. They were released formally Tuesday at the Public Health Council meeting, and they are available on the website. And it seems kind of mundane maybe to say it's exciting, but we have not had in the past a standard list of what are all of the things that everyone should do. You needed to be expert in what was in the legislative annals. You needed to be able to have access to experts in each of the different fields. And now it's available to everyone, and that gets a long way towards getting past the fact that what public health services look like and how they are delivered varies significantly from zip code to zip code. And in addition to this, well, as part of the standards too, there's some data. I too love data, and there's a great interactive map. I tried to share it on my Board of Health meeting last night and I failed miserably, so I'm not going to try today. But there's a great interactive map where you can hover over, you can see the 305 communities that are in shared services arrangements. You can see the standard that, what level they're at. For meeting this first set of public health standards. And it also breaks down kind of the self-report of what are the barriers to meeting the standards fully. Is it an issue of training? Is it an issue of staffing? Is it an issue of funding? Or is it an issue of a lack of awareness? And those things, the standards and this data are super helpful for Sam and I as we roll out and work with the different communities, because we can really give some clear information of where we ought to be directing resources, and then get feedback from the towns on how and whether they want to do that. And I think that's all. I don't know if there have any questions, and Sam might know what you might want to add.
Sure. I think Carrie covered most of it, but I'll just add, we continue to work really closely with the Needham Environmental Health team. We've implemented monthly meetings with them to discuss things in general, but also with a goal of standardizing our inspectors as much as possible across shared services and Needham. So one project I've started to work on with Pamela Ross-Cum now is creating standardized comments that we can add to Food Code Pro. Just to increase efficiency in the field for inspectors, but also with that big goal of just standardizing how we're citing violation observations and then also corrective action. So more to come on that.
Great, thank you both. Any questions? Okay. Tim, over to you for any other items or updates.
So there's no other items right now. The big thing will be we will just going over sort of the takeaways. I will get in touch with Ed when he gets back next week and confirm whether November 17th works. If it doesn't, then I'll send out a doodle poll to all the board members. We will bring back next month an edited code of conduct. We will bring back some additional information on the individual serving alcohol, individual serving bottles of alcohol. And hopefully we will bring back good news about the votes at town meeting on opioids and youth mental health. And then board members are welcome to attend. I don't have a date yet, but historically in November, the town manager holds her budget hearings with departments. And then sometime, and it could be December, January, February, maybe even March, the finance committee will hold its meeting with departments. So the finance committee, town manager has to recommend a balanced budget and present it to finance committee, or present to the select board and finance committee. Then it's finance committee's budget. So they generally take the town manager's budget and adjust up or down. The finance committee's budget is what goes to town meeting. So in terms of our priorities, it would be great to have one or more members of the Board of Health come to some of those events, or just take a chance to talk to select board or finance committee members.
Well, yeah, you can keep us posted on dates and
Yep,
we can figure out who's available.
absolutely.
Okay, anything else? Motion to adjourn.
So moved.
Second.
All in favor, Rob,
Yes.
Kathleen,
Yes.
Stephen,
Yes.
Pedro, yes. All right, thanks, everyone.
Thank you.